Are you unable to lift your arm fully overhead? Does your shoulder pain wake you up at night? Is it becoming difficult to wear clothes or comb your hairs? If yes, this may not be simple muscle pain. It could be frozen shoulder, a condition that slowly reduces shoulder movement and function. Many people ignore it in the beginning, and that delay can make recovery longer. Hello, everyone. I'm Dr. Raza, and you are watching Dr. Raza Health 360 MD. Today, we'll talk about frozen shoulder, its causes, symptoms, research based treatment, and exercises that actually help restore movement. What is frozen shoulder? Frozen shoulder is medically known as adhesive capsulitis. It occurs when inflammation and fibrosis develop in the capsule, right here, surrounding the shoulder joint, causing stiffness, pain, and limited movements. International research shows that frozen shoulder affects about 2 to 5% of general population. Although not extremely common, it is a significant cause of shoulder disability worldwide. Now, one of the strongest risk factors is diabetes. Research studies and meta-analysis shows that people with diabetes have a 2 to 4 times higher risk of developing frozen shoulder. Some studies report a prevalence of around 13% among diabetic patients. The reason is believed to be related to high blood sugar affecting collagen structure, making the joint capsule thicker and less flexible right in this area. That is why blood sugar control is a key part of the treatment. Now, stages of frozen shoulder usually progresses in 3 stages. Number 1, freezing stage. Pain gradually increases. Frozen stage. Movement becomes restricted. And thawing stage. Slow recovery begins. This entire process may take several months. Patience is very important during recovery. Now, symptoms. Common symptoms include shoulder stiffness, difficulty lifting the arm like that, pain when moving the arm backwards like that, night pain, difficulty performing daily activities. Research shows a strong relationship between shoulder pain and reduced functional ability. Now, what is the treatment? The good news is that frozen shoulder can often be treated without surgery. Clinical guidelines recommend physiotherapy and home exercises as first-line treatments. Range of motion exercises and manual therapy helps reduce pain and improve mobility. Consistency matters more than intensity. Now, heat plus exercise therapy is commonly recommended. Applying heat improves blood circulation, relaxes muscles, and reduces stiffness. Studies suggest that combining moist heat with stretching exercises can improve joint mobility. Even simple daily heat therapy for 10 to 15 minutes can be helpful. Now, most effective exercises, movement is the most important part of the recovery. So, commonly recommended exercises include pendulum exercise, wall climb, towel stretch, cross body stretch. These exercises gently stretch the joint capsule and improve shoulder mobility. They should be done twice a day within pain limits. Never force the movement. Important message. One important thing to remember, avoiding movement due to pain can actually make frozen shoulder worse. Controlled movement is the path to recovery. When the joint capsule is not used, it becomes even stiffer. Every patient is different. Some patients have more inflammation, others have more stiffness, and some have a history of injury. That's why proper diagnosis is essential. Avoid self medication and consult a doctor when needed. Now, let me ask you something. Do you have difficulty lifting your arm? Do you feel shoulder pain at night? Or does your shoulder feel stiff? These could be signs of frozen shoulder. Let me know in the comments. And if you find this video helpful, share it so more people can benefit from it. I'm Dr. Raza, and I will see you in the next video. Your better health is my mission. Goodbye. My name is Dr. Raza. I'm a practicing family physician in USA for the past 18 years. I'm an American board-certified physician and diplomate of American Board of Family Medicine.